So immunosuppressants will increase your risk of infection. Fact. And if you've got a chronic condition, so if you've got a condition, chronic means, lasting a long time. If there's an acute problem, so acute means lasting a short time. So acute and chronic in medical terms are different slightly to what acute and chronic are in lay terms, if you like. So we use the word acute to mean short period of time and chronic meaning a long period of time. So if you've got a chronic condition where you're on immunosuppressants and nothing's going to change, then we've got to make a judgment. If you have an acute flare up, for instance, and maybe if you're a bit up and down with your inflammatory condition, then we would say, look, let's get it stable. So you don't really want to have surgery if you're maybe having a higher dose of immunosuppressant than you might be having in 3 or 6 months or in a year. So if there's any chance that things are going to get better in the future, then fine, then you're better off waiting. But if your condition is chronic and it's just like this for a long time and you're stable, and again, we would ask you to talk to your gastroenterologist, or we would talk to them if you wanted. We would write to them to say, what do they think, and whether there's anything that they need to do to optimize your medication. So that's the first thing. Your medication needs to be optimized. What do we know what the surgery is? So whatever the surgery is, let's say it's some kind of, I'm not sure what the surgery is. So let's say it's some kind of body contouring procedure, like a breast lift or a tummy tuck or something like that. One of these procedures where you're closing skin tight. Smoking is a disaster. And I understand that it helps you with your condition, and it might make your condition, here we go, breast lift. I stop smoking. Okay, so I understand that smoking might got it, Keely, breast lift, so might help you with your condition. But from a surgical point of view, smoking and a breast lift is a disaster waiting to happen. And it's not like I've got it in for smokers or anything like that, but I say to people, if you cannot stop smoking, then don't have a breast lift. It's that bad. So if you cannot stop smoking, or rather if you sort of don't want to stop smoking because your ulcerative colitis is going to get worse, I don't mean don't want in a sort of, I understand that it makes your condition better and that's what you're worried about. You're going to get a flare up, but it's just not compatible in my view with having surgery. And it's just a question of managing that flare up, whether I don't know what to say about that. And again, we probably have to seek help with your gastroenterologist with that, or whoever's looking after your condition to try and work something out. But you really need to not smoke if you are having surgery like a breast lift, because the wound is closed under tension. And if that wound doesn't heal up, it can be catastrophic. And smoking is bad. I mean, it can happen even if you don't smoke. And you're throwing into the mix the fact that you're immunosuppressed, so that does increase your risk of getting a wound infection, which again can be bad with a breast lift. So there's no question, Keely, that you're putting the odds, sort of against you in a way compared to someone who hasn't got the same condition as you. And there's no question you're increasing the risk that you might get a problem. Fact. And I guess it needs a discussion, because you might say, forget it, mate, not having that. If I'm going to get all these problems, my breast lift is not that necessary, so I'll just stick as I am. And I'm like, well, then that's probably a reasonable thing to do. Or you might say, it's ruining my life, I don't care, even though I get an infection, sort of thing. In which case you might want to go ahead. But it's a difficult one, Keely. I don't think there's any answers, and it just needs to be weigh up the pros and cons between yourself, us, and the person who's looking after your ulcerative colitis. But it's a tricky one, that, Keely. Tricky one.